probably about 3 to 5 minutes per patient. And so they're looking to see the symptoms. The next one will be individual registration. That takes about 5 minutes. The drive-through staff will take the information. You need the name, phone number, email, address, different types of payment information. This will be put into electronic data collection tool, and then obviously will be used to be able to notify people of their results. And then the station 3 is they swab, they do the swab so that you're able to have your sample sent. Obviously, it's only if the patient authorizes it. If you don't want to go through with it, you don't have to. But once that, you exit the site. So the whole iteration, is going to be 10, 15 minutes once you get in the queue. Obviously, there's going to be people waiting in line. I think the guard and the local folks in our Broward site, I think did a really good job of working people through. So I've told everyone to be mindful of our residents' time. A lot of people are antsy now. We want to get them through as smoothly as possible, and I know they're going to try to do that. The samples will be tested twice daily at a commercial lab in Miramar, and we want to get those results back as soon as we can. Obviously, they have a crunch at capacity with all the people that are sending in test results, but we know people want to know quickly, and we're going to work as hard as we can to do that. This is the second federally supported site in Florida. The first one opened yesterday in Duval County at the Jacksonville Jaguars stadium. They tested 288 people, which was a good thing. There also wasn't as strong a demand as there was in our Broward test site, which may just mean fewer people up in that part of the state are symptomatic. We'll have to see as this goes on. But I want to thank everyone who was involved with that. I know the city of Jacksonville worked, as well as the fire rescue and the sheriff's office in Jacksonville. Our division of emergency management helped out with that, and we're going to keep that one going. Orange County, Florida. This is set to open on Wednesday, another federally supported test site. You have the Division of Emergency Management here in Florida being the on-site coordinator. We will have support from the Florida National Guard, the Orange County Sheriff's Office, Orange County Emergency Management. And so those are opportunities for folks to be able to go in and get tested. There's enough supplies to test in each location. About 2,500 people right now. Obviously, we want to backfill and add more supplies. We have the first site that we helped with the Guard open was in Broward County. That was opened on Friday. And it was similar to this. It was at one of the parks in Pembroke Pines. We were hoping to let it go smooth. We wanted to we thought we'd get about 250 people through there a day. On day one, they were able to get 745 people through the lines, get samples, send it off to be tested. And then day 2 yesterday, there were 701 folks who were able to go through and get tested. They're open again today, and I just want to thank them for all their hard work on what they're doing. So I just want to let people know in terms of what the test results, some of the things that Florida is seeing more reported positive cases, but some of that is to be expected because Florida is testing a lot more people today than it was able to do, initially. Initially, we would have to send everything to the CDC in Atlanta, very turnaround time. The criteria that the CDC put in was much more restrictive. So that is now changing. There's more opportunities for people to be tested, and so we'll get more positives. But that actually helps us identify, where some of these areas are, and then be able to tailor whatever measures need to be taken to try to protect folks. I would say as testing has increased in places like Broward and Dade, we have seen more overall cases, but the percentage of people who test positive have declined. And so you have, even under criteria where you have to be symptomatic, the vast, vast majority of people are testing negative for this. So I just want to put people at ease. This is an issue we've got to deal with. It's serious. But it's something that still at this point, the vast majority of people are testing negative for. And so it something, and I say also this. People ask, I think people are confused because they're like, okay, what's going to happen next week or 2 weeks or a month or 2 months from now? And, we're working in conjunction with the President's Advisory Committee, the CDC, and obviously our local governments. We're really trying to follow the CDC guidance and support the 15 days to stop the spread. And I think that's very, very important. But I think people look at it and they're like, man, what do? Here's the good news. There is a lot you can do in just your individual lives to be able to protect yourself from acquiring the virus and from passing it on to somebody else. This is a virus that is contracted usually through respiratory droplets when somebody coughs or sneezes. So this is usually someone that you're in close contact with within a 6-foot radius. You also can get it if those droplets fall on a surface and you touch the surface and then touch your face, although most of the cases by far are from people who you've been in close contact with. If you look at the cases in places like Broward and Dade, you have a pretty significant percentage related to international travel, and then another significant percentage of people who you've been in close contact with, known contacts who are carrying the virus, and that close contact is what allows the transferability. So when people talk about social distancing, what they're basically saying is, protect yourself, avoid of crowds of people, keep your distance if you're in public. If you stay in those comfort zones and don't go and have close contact with someone that's infected, then you are going to be protecting yourself. If you're making sure to wash your hands and not touching surfaces that could be infected, you will be doing a lot to protect yourself. And so that individual conduct is something that's very, very significant. So just know this is not a disease like the measles, where if you just happen to walk past somebody or be in the same room you may breathe in. It's not as contagious as that. It really is more of a close contact. It's still something that's contagious, and they think it's more contagious than the flu. But if you just take those precautions, you're really going to help stop the spread, help protect yourself, your families, and others. Most of the cases typically are in the same household where somebody's infected. They're obviously living and eating and with their family members, and then it's contracted that way. Finally, we have a facility update. I mentioned yesterday statewide, we're keeping track of the availability of beds. One of the key things on this is obviously, how fatal it is, which is very serious. We know most of the fatalities have been with people who are elderly and or have a serious underlying medical condition, and the ones that have both, they're elderly and a significant underlying condition, they're the most vulnerable for fatalities. But we also know that there's a certain percentage of people who, while they don't die, are going to require hospitalization. And so the hospitalization rate is something that we're following very closely, the number of beds and the bed capacity statewide. So we're at about 18,131 available beds statewide, and we're about 1,700 ICU beds statewide, and 34% of our hospitals statewide have 50% or greater capacity right now. My agency for healthcare administration has been in communication with 6 vacant medical facilities throughout the state, which we are, if we need to utilize it for the COVID-19 response effort, they're evaluating how that would work and how you would set it up. That obviously there's a lot of logistics involved in that. Our Department of Emergency Management also has some facilities that could be put up. All that is being said, we hope it doesn't come to that. We do have capacity, but we got to do our part to stop the spread of the virus so that we don't end up overwhelming the healthcare system. Rundown of the numbers of cases. We've had 768 Florida residents test positive for COVID-19 as of this morning, 62 non-Floridians who have been in Florida recently. The number of fatalities statewide is 13. We've had close to 8,000 negative test results. In the state health department labs, there are 962 pending test results. But understand, there's so many of these tests now being sent to the commercial labs. At the state, we don't have visibility on what is being sent to the labs. We get the reports on who tests positive, and we're supposed to get on who tests negative. So there's probably many more tests that have been outstanding. So you've seen a scale up in the testing capacity. We want to continue doing that because we think that that's important. Total amount of positive cases, Broward is 180 and Dade is 177. So pretty comparable. Obviously, Dade would have fewer per capita because it's a bigger county. But those cases combined with Palm Beach are close to 50% of the total infections that have been reported in the state of Florida. So we want to work hard with the folks in South Florida on the prevention and mitigation and containment efforts. And I know a lot of the folks here at the county and city level have been working tirelessly to help get this done. So I look forward to people being able to come out tomorrow, get some of these very needed tests. I want to thank the National Guard for really responding very quickly. Just 2 weeks ago, everyone was still sending it to CDC. Once we figured that out, we got the Guard to put this up very, very quickly, and they did a really, really good job doing it. I'm going to have the governor come up, say a few things for the Spanish audience. Then we'll hear from Jared Moskowitz, and I also want to thank Carlos Magoya from Jackson Hospital. They are partnering with us on this, and I think that they've been a good partner. We also want to work with Jackson and Carlos to do another site in a different part of the county. Certainly as we get supplies, I'm willing to put in state resources for that because I think it's important. So it's just a matter of getting everything lined up, making sure we have enough swabs. But Carlos has been great, Jackson has been great, and they've really helped step up to help support the population here in Miami-Dade County. So with that, I'll introduce the Lieutenant Governor.
Governor, buenos días, muchas gracias por estar aquí con nosotros. Estamos muy entusiasmados de poder anunciar que oficialmente mañana este sitio estará abierto para poder recibir pruebas de COVID-19. Como han oído, el gobernador ha tenido como su enfoque y una prioridad asegurar y expandir lo que es la capacidad de poder someterse a un examen. Este sitio es en colaboración con el gobierno federal. Es uno de 3 sitios. Ya abrimos el de Jacksonville anteriormente y en esta semana se va a abrir uno en el área de Orlando. Este sitio estará abierto los 7 días a la semana y estamos muy contentos de poder colaborar no solo con la Guardia Nacional, que va a proveer el equipo médico para asegurar todo lo que está sucediendo en este procedimiento, pero también el gobierno local, el Hospital Jackson y el Departamento de Servicios de Emergencias. También, como han oído, el gobernador indicó que va a hacer un procedimiento. La evaluación se va a hacer debido a lo que es las regulaciones, asegurando que las personas mayores de 65 años de edad con síntomas y también el personal médico y nuestros policías y bomberos que están en contacto directo con pacientes. Estamos de nuevo muy entusiasmados de poder anunciar este sitio aquí en el área de Dade County. Además, hemos tenido mucho éxito en el sitio de Broward, en el CB Smith Park, donde hemos podido ver más de 700 personas diariamente. De nuevo, estamos asegurando no solo la capacidad de lo que es las pruebas, pero también asegurando lo que es la capacidad de nuestras camas de salones de emergencias, de camas de servicios intensivos, y estamos coordinando a todos niveles, no solo a nivel estatal, a nivel federal y también a nivel local. Seguimos monitoreando esto muy acerca. El gobernador ha dicho que por favor cada persona tiene que tomar sus precauciones, tiene que hacer lo debido, asegurar que se está manteniendo a una distancia suficiente, asegurar que se están lavando las manos con frecuencias y por favor si tienen alguna pregunta pueden someterse a lo que es el website del Departamento de Salud y estaremos dispuestos para seguir lidiando, a seguir asegurando el pueblo que estamos al frente de esta situación bajo el liderazgo del gobernador DeSantis. Muchas gracias.
Governor, Lieutenant Governor, thank you. The Division of Emergency Management is happy to partner with the National Guard here, and I want to thank the National Guard. I want to thank all of the emergency management personnel, not just from the division at the state, but all over the county, all the county emergency management personnel, all of the health personnel at the county level, who some of them are rushing into the middle of the night into facilities to try to isolate people to save lives. I want to thank all the hospital workers around this state who are on the front lines in our hospitals. This really has been a collaborative effort. City officials, county officials working together to make sure that we are providing the necessary resources, providing the necessary care in the state of Florida. As the governor spoke about, the division is constantly running our logistics operation 24 hours a day out of our warehouse in multiple locations. We have about 300,000 N95 masks that came in yesterday that are going to be blasted out to all of the mission requests to fill the most critical needs first. And then over the next week, we are receiving 2 million more N95 masks that we will get out to healthcare workers, nursing homes, and folks even at the Department of Children and Families who are doing inspections, and I thank them for their efforts. We have set up a field hospital. It's being constructed currently in Broward County. One more is on its way here to Dade County, and we will get that set up as well. Each field hospital can accommodate 250 people, and that really is a segue between a hospital and then potentially having to set up an additional permanent facility. We've also gone out and procured 3,000 beds, including ICU beds, so that we can expand capacity at current hospitals, as well as having 300 plus nurses and physician assistants on standby so that we can surge into a hospital at any point in time, as well as having 300 medics with the National Guard. I want to talk about social distancing. There's a lot of different articles out there of what to do, what not to do, a lot of things being studied, but the one thing that we know for sure is that social distancing works. And even if something is open still, it doesn't mean you have to go to it. I know young people are thinking that their spring break has been ruined or their summer has been ruined, but to the young people out there, you could ruin somebody's life. You could ruin a family's life by not social distancing. This is just a spring break. It's just a summer. The beaches will still be there. And so we need everybody to do their part. If one segment of the community doesn't do their part, it affects everybody else. And so we can isolate people that are older and that are susceptible to this, and we are doing that every single day. But we need the young people to do their part. Call your neighbor. If you know your neighbor is older, if you know your neighbor has an underlying illness, call to see if they need supplies. You can be a hero. Now is the time for everyone to step up. We know that this doesn't matter who you are. If you're rich or you're poor, it doesn't matter your race, your nationality, your creed, your sexual orientation. It does not matter. It affects everybody. But it affects older people more. And we want everyone to do whatever they can to try to help their neighbor and help the older population. Governor, thank you.
Bring up Carlos Magoya in a second. I just want to also thank both the county mayor, Jimenez, city mayor, Francis Suarez. Obviously, Francis tested positive, but he's been working. We've been working with him. Mayor Jimenez, I don't think had positive, but had self-isolate. He's been working very hard. We've been working hand in hand on all these different issues. They're both doing a really good job being under constraints, especially. So I just wanted to thank them for their partnership, not only in this test site, but in the other things that we're working on in Miami-Dade County. I also want to thank the other folks at both the county and city level. I know we got the deputy mayor here. He's been working very hard. Thank you, sir, for what you're doing, because this is a big county. There's a lot going on, and there's an awful lot to do. I want to bring up Carlos Magoya. Jackson has been very strong on getting out in front of this. He's wanted to work with the state and feds on anything that we've needed, and this is just one place. We would like to work more with Jackson in the very near future, and so I just want to thank him for all he's done and all he's doing for Miami-Dade. Where you at?
Thank you, Governor, Lieutenant Governor, Director Moskowitz. Let me tell you, we really appreciate what the state has been doing here, and now the federal government with these opening up this drive-through here. The opportunities that we're going to be able to do are just incredible. We at Jackson, along with Miami-Dade County and Mayor Jimenez, and also with Jaguars and many of the other municipalities and the mayors, here we're at the City of Miami Gardens, and we have Mayor Oliver Gilbert right behind me, which is also one of the big supports that we have. So everyone is working very, very close together to make this happen. The purpose we are here, we are a consortium of hospitals. It's not just Jackson. Jackson's working with a UN partner, as well as Mount Sinai, Nicholas, and Baptist. We're all working together, not only in the drive-thrus, but also in the inventory and understanding what's happening in beds. I want to make sure that everybody understands for the last week, most of us have been reducing or eliminating elective surgeries. So the number of beds at every hospital has dramatically increased over the last week. In addition to that, we've all been acquiring vents, so we have an opportunity to convert a big percentage of our hospital beds into ICU beds, so because a lot of the needs here is around ventilators. So we're working on all that stuff. So here, as it relates to the drive-through specifically, we're going to be working with the National Guard as a standpoint to make sure that we continue to have the quality of the specimens to make sure that we can properly test them. This will be the first of many. We're in the process of trying to open another test site you'll hear more about in the next day or so with the cooperation of the state as well as the county and the City of Miami. But there'll be other sites that we're doing around the county. We want to make sure that we test as many people as possible. The governor said this, but I can't say this enough, and I don't want to be redundant. The most important people to test at this point in time are those over 65 that have immunity issues. Why? Because the faster we learn about them testing positive, we can get to them quicker. The disease, as it relates to people of that age that have immunity issues, the more complex they become, the higher the acuity is, the higher the morbidity. So we want to make sure that we can identify those earlier and be able to work with them in advance so that we can make sure improve the quality of life for every one of those people. So as you will see in a lot of these drive-thrus, a lot of the focus will be on people over 65 that have symptoms, and we will address what they need to be doing from that standpoint. I know there's a lot of panic and hysteria out there. We want to make sure that the governor's doing a really great job of communicating out there all the time. We need to make sure also Mayor Jimenez and every other municipality that we can communicate, and we're all there together. And I can assure you the Jackson Health System, along with the University of Miami and the rest of our consortium, are very much aligned to make sure that we can go through this as best we can. Thank you.
And also just want to let people know the people coming through here starting tomorrow. We actually have some folks going through now. Some of the first responders. This is they're kind of beta testing it. It seems like it's going well. But tomorrow when people come through here, if you get tested, the folks here are going to get that to a commercial lab as soon as possible. I mean, we understand how antsy it is waiting. When the CDC was doing this, it was taking time, days, and people were. It was really frustrating. So there's a premium on getting this turned around. There is a commercial lab very close in Miramar. They obviously have a lot of demands coming in from the rest of the country, really, and that's true all over. It's a major crush. But we want to get the results as soon as possible. That said, if you are somebody that is tested, you need to follow the directions of the folks here regarding self-isolation. If you're somebody that is displaying COVID-19 symptoms, if you come in here and get tested, you're going to self-isolate until your situation can be resolved. And they may even have you continue to self-isolate beyond that, because there are people who acquire it, initially test negative because the virus isn't strong enough, and then they test positive. So just keep in mind that that's going to be something that's very, very important. We obviously want to identify people so they can get treated if needed. Most people will not need treatment. Most people, as long as they're at home and as long as they're not infecting other people, it'll wear off. I talked to Mayor Suarez yesterday. I mean, he said it was very mild. Now, that's not going to be true for everyone, but for most people, you are not going to require a stay in the hospital. You'll be able to stay at home. So the important thing is that you do stay at home and that you don't transmit it to anybody else. As long as you got it, if you have it and it stops with you, then COVID started to become, we were monitoring this in January, February. So we knew the virus, what it was doing. We understood the places it could come from. The Department of Health was self-isolating anyone coming from China or any of these places. And fortunately, very few of them actually had it. But as we started getting into this, once we got into probably sometime in February, it was pretty clear that this was a virus that did not attack all people equally. The Spanish flu in 1918, that specifically attacked at a lot of prime age working people who were otherwise healthy. There's other pandemics that have attacked children. Fortunately, this doesn't attack children. Unfortunately, it tends to have the most serious consequences for elderly folks, but particularly elderly that have immune system issues or other types of serious underlying conditions. So once we found that out, we were one of the first, if not the first state, to issue a series of requirements for every nursing home and every assisted living facility to basically limit access, or in some cases deny access, to people from the outside world. Any of the staff must screen for health every day. This is very, very important. CDC then followed the state of Florida and issued similar guidelines. Those were more reaching, but they were good guidelines as well. And everyone has been on notice that this. The good news is there's a lot of people throughout the state of Florida involved with nursing homes and assisted living who are working hard. They are implementing the guidance, and they're protecting their residents. We did have one nursing home in Broward. We've had 3 fatalities, people who had acquired COVID-19. And the reason that happened is because the facility did not follow any of the regulations. The construction staff, the food service, the regular staff, they were coming in when they were sick, and they were allowed to enter these facilities. Some of it was independent living, some was assisted living. That is not doing your part to take care of our most vulnerable. And if you're somebody who is in one of those assisted living, if you're somebody involved in running a nursing home, you have a special responsibility to take care of those people in your stead. What we did with the one in Broward was we have law enforcement now embedded. We have somebody from the Agency for Healthcare Administration embedded, and there's now somebody from the CDC who's embedded. And we'll put resources where we need to, but I would just, it should never even come to that, because if you're somebody who's managing one of those facilities, you know what your responsibility is, you know the precautions you need to take, you know what the rules are, and you need to follow it. If you do that, we will be able to protect our most vulnerable population. That will go a long way to reducing the fatalities that we would otherwise see due to COVID-19. If you're careless and you let sick people come in around them, that is not something that is going to be good. That's going to cause major, major problems. And so it's a major issue. We've taken dramatic action, and we will definitely hold people accountable for not doing it. Oh yeah, no. They should have followed the guidance for sure. No, absolutely, yeah. They didn't do it. So. Well, so no, we didn't say they have to have the masks. Jared had mentioned you have millions of masks that are going to be in our possession very soon. That's going to be pushed out to folks throughout the state of Florida. When you hear one of the things, Carlos Magoya talked about, they've stopped elective surgeries. You have more bed capacity. That's obviously very important. One of the reasons I did the executive order to stop the elective surgeries is, yes, for bed capacity, but we also want to conserve the personal protective equipment, things like those masks and those gloves. Once this pandemic hit, there was a major shortage of this. So, the state has some in reserves, a lot of the hospitals, but every time you see a COVID patient, you got to use new PPE, and it really is important that the hospital staff have it and that people now in these nursing homes are protecting from infecting anybody. And if they're doing the screening and they're following the regulations, the chance of an infection is very, very low, because most of the transfer are with people who are showing some symptoms. But if you have that mask on as well, that's going to further reduce any type of mission. And so I want to thank Jared for getting this. There's a global rush to get these N95 masks right now, and for him to have millions coming to Florida, understand most of the stuff that's out there is being sent to New York City right now because they're having over 100 new cases an hour. They obviously are a very close community in terms of public transit, all that. So I'm sure the spread has just been unbelievable. And so for him to do that, I think is very good. So that's coming out for folks. As we get them, we put them out, and it's very, very important that people are protected. Thank you.
Guys.